Hello again. So one of my roles, so in my research area, it's a focus on nutrition in children. But one of my roles in cooperative extension and in the department is to provide sort of nutrition updates, we call them, for nutrition professionals throughout the state, especially throughout the state, in different issues of nutrition. So there's always different fads, different topics that come up that I do my best in trying to address. And they change all the time. So I chose a few of the more popular ones for right now, and we will just see how it goes. So we've really changed, the public's changed expectations of a healthy diet. Several years ago, the idea behind nutrition was the prevention of essential nutrient deficiencies. And then, that looks funny there, but it's the reduction, we've grown more towards this hope for nutrition and the realization that nutrition has an important role in various aspects in our lives. In terms of the reduction in the onset of progression of selected cancers, reduction in age-related diseases, improvements in endurance capacity and mental health, and the reduction in the occurrence of select birth defects, all contributing to this concept of optimal health. And so nutrition really, since over the past few years, like Lucia and I started off together in this field. We were actually in graduate school together. And the study of nutrition's changed quite a bit. In my view, it's gotten a lot more exciting in that it can relate to so many parts and different aspects of people's lives, and consumers are so incredibly interested in it. A lot of that interest might not be founded in actual science or in reality, and a lot of it really is an emotion and a hope to live forever and a hope to prevent all of these diseases. And we know that nutrition does contribute, and you've learned all about that, to the reduction of certain types of risk factors. But sometimes consumers and the public gets very misled on different types of recommendations that hit the press. So I'll talk about that a bit. So why all the confusion and conflict? Well, the science is just always evolving. The more research is done, the more we learn. The more, as our technology increases, as our methodologies improve, we can find more different results. And it doesn't mean we're always changing our minds, but we are taking a look at what newer results are saying and getting a greater understanding of the field. So as we continue as scientists to explore these complex relationships, recommendations change, nutrition evolves. And all of us, all of you that are taking a look now maybe in your courses about the literature, it's hard to keep up. Even within tiny little areas, let's say if I'm working in child nutrition, just keeping up with the literature within that little field is so difficult. So trying to stay on top of it to be able to explain these changes, new recommendations, and the basis for it to the public is quite a challenge. And so it's important, again, as people and as you, as students, as your friends, as your family find you're taking different nutrition and public health classes, they're going to ask you a zillion questions about nutrition. And it's quite common not to feel competent in being able to answer them because you haven't learned every aspect of nutrition. I haven't learned every aspect of nutrition. None of us ever will. But it's important to understand how research is conducted to be able to interpret what is actually out there and really get beyond what we call the hype. And so it's important as you're going through your studies to understand that it's an interdisciplinary science, and it's important to read and interpret the scientific literature, to look for controlled experiments, to look for studies that are repeated, where there's some kind of consensus. And this is where we come to these evidence-based recommendations. How many of you have heard of evidence-based recommendations? How about the dietary guidelines for Americans? How many of you have heard of those? Well, in nutrition, a few of you, in nutrition, there'll be established recommendations. There's several different ones, but the dietary guidelines for Americans are those which are evidence-based, that come from a large body of scientists that are published every 5 years. And it's, what it means by being evidence-based is we'll have panels and committees that work on those that are experts in a given field, that review all of the literature, so there'll be stacks of papers, publications, in a given area, that group, and I'm simplifying it, but that group will come to some kind of consensus on. And nutritionists are always arguing, and if you go to national meetings, you're going to walk by rooms where there's always arguments going on about nutrition. It's sort of a fun reason to get into nutrition if you look at it that way. But they will come to consensus eventually to develop these documents. So an example of that are the dietary guidelines for Americans. So when you're trying to take a look about what's known, for example, in your specific area of interest in nutrition, if you go to the dietary guidelines website, you can Google it if I don't have it up here, you could see the list of literature that they have used to come up with these recommendations. But it really can help you understand and to learn how to differentiate between the hype and what's actually known from studies, and recognize that it could change next month. It could change in a few months as more and more studies are published and more work is done. Okay, so one of the very popular areas are organic foods and whether they're safer or not, or healthier than conventionally grown foods. So there was a press release, there was a newspaper headline just a few weeks ago about, coming from a review that talked about this exact issue that I'll mention here, but I'll go through a little bit on organics and what at least we know for right now, and I'm really going to focus more on the nutrition aspects of that as opposed to other environmental concerns, because that's not my expertise. So in terms of, just to give you sort of a common ground, as of 2002, the United States Department of Agriculture made it clear that all foods that have this USDA organic label, they must contain at least 95% organic ingredients. There are no claims at all made by the USDA that organically food or organically produced food is safer or more nutritious than conventionally produced foods. And due to the complexity of this issue, and there is a real lack of very well-controlled studies, there are no national recommendations regarding the consumption of organic foods. So nevertheless, for example, in the programs I talked about, I am surrounded by people that are in this area that just want to make sure that children, for example, are getting organic produce. So we are trying, just again, because of that emotional connection. But keep in mind, there is no strong evidence about the nutritional benefits of organics, but I want to mention what we do know about them. And some maybe trends, you can say, or something that I certainly think needs more work in the future. But there are a lot of concerns about the effects of conventional farming practices on the environment and on human health and on animal welfare, and also the perception that organic foods are tastier than their conventional alternatives. And that may or may not be true. More work needs to be done on that. And again, for the purpose of this presentation, I'm going to talk more about human health. So we know, you've heard, and I will show it in a variety of type of slides, but the majority of Americans are not meeting the current recommendations for fruit and vegetable consumption. This was a slide that was actually put together by the Alliance for Food and Farming, which is a group of farmers from both conventional and organic productions, and just basically showing that fewer than 20% of Americans are meeting the current recommendations for consumption. So there are concerns that consumers are actually, what they're calling, in this alliance at least, scared fat. And are consumers being scared away from healthy foods. They're hearing about the dirty dozen, which I'll talk about. They're hearing about all the pesticide-laden produce. And we know that organics are a bit more expensive than conventionally grown produce. So are people, or parents, or adults afraid to buy conventional food because they're loaded with pesticides? And are they then staying away from the consumption of different types of produce. And a lot of the slides on this area, I should mention, were presented by a colleague, Dr. Carl Keene, in our department at the Society for Nutrition Education meetings this last summer, where they did a whole symposium on that. But this alliance that I mentioned, the Alliance for Food and Farming, they were formed several years ago to address some of these issues and concerns of the public. And they conducted consumer research, and one of the questions is, how concerned are you about pesticide residues on fruit and vegetables? And you can see that there's a very high concern and a high proportion of moderate concern as well. The public's worried about it. We need to address it in one way or another. And are there any fruits or vegetables that you have stopped purchasing as a result of these concerns? And you can see that there's close to 20%. There's 70% that actually aren't purchasing certain types because of their concerns. So again, it needs to be addressed. It needs to be addressed in a consumer-friendly way that's based in science, but not talked down to either, and just presenting the facts. And really this Alliance for Food and Farming does a very good job of that, and I'll show you where their website is in a few minutes. So again, why all the confusion? Most everybody in science and nutrition, in public health, agree that consumers should be eating more fruits and vegetables. And really, consumer research suggests the most credible people to deliver this type of information to consumers are physicians, nutritionists, and dietitians, of course. And it should be mentioned that physicians get very little training in formal nutrition. And so there are programs to improve that area in different areas of nutrition, and newsletters and updates that are sent to the medical field as well. But really, the popular media is where consumers are getting their nutrition information. Dr. Oz is doing a heck of a job getting that information that is not based in fact out to the public. We need to do a much better job of doing that. Okay, so really a lot of the negative messaging is accepted as factual. This environmental working group is a nutrition advocacy group that have people that have not had a background in nutrition or this area of science or pesticide assessment that will come out with statements such as this. The growing consensus among scientists is that small doses of pesticides and other chemicals can cause lasting damage to human health, especially during fetal development and early childhood. Not that this group evaluated the actual science behind all of this, because they have to look at a variety of factors. But these headlines are what make people scared. With a report findings that came from this alliance I mentioned about, they found that those types of headlines, plus this list like the Dirty Dozen, which I'll mention, can be an impediment to people purchasing fruits and vegetables. The list can mislead consumers. They do not provide any type of basis to assess risk, and I'll talk just briefly about that. And there's really no scientific evidence about the levels of pesticides found on fruits and vegetables pose human health risk, providing people wash their produce. Wash it thoroughly. And wash it whether it's organic or conventional. Because if it's organic, you're going to have bird droppings and you're going to have animal droppings, and you got to wash it. So I have had people often say, I don't need to wash that because it's organic. This, by the way, is my daughter-in-law saying that. So it's like, no. So you do. I mean, things happen. It's not, organic's not the all savior of preventing any type of food poisoning, okay? But in general, when we're talking about pesticide risk, and of course there might be an increased residue left on that relative to conventional, which I'll mention, you wash everything thoroughly, okay? And that is really key. This is a Dirty Dozen list. I don't know how many of you have ever heard of that. I get phone calls on it all the time. But talking about how you must buy the organic versions of this because these are the ones with loaded amounts of pesticides. And so you can see some of the things that are mentioned. Blueberries, for example, are up there. Strawberries. These are some key fruits with a phenomenally high content of certain phytochemicals that have been shown to have some very exciting findings in terms of positive effects on our health. So again, you wash them, okay, and that's what's important, as opposed to people being afraid to eat them. But the headlines are much more exciting than me saying in a headline, wash your fruits and vegetables. People are going to get more involved in that. I'm not going to be in Dr. Oz saying, wash your fruits and vegetables. This type of stuff will be. So I want to tell you a little bit about this, because I don't want you to think that this is the industry saying everything's okay. This Alliance for Food and Farming is a nonprofit that was formed in the late 90s. It includes organic and conventional farmers. The contributors are farmers of fruits and vegetables. There's companies that sell or market and ship, and organizations representing farmers, again, both conventional and organic. Their mission is to deliver credible information to consumers. They do not engage in any type of lobbying activities, and they don't accept any money or support from the pesticide industry, and that's really key to know that. This is on their website. If you go to the Save Fruit and Veggies website, there's a phenomenal amount of information on there. What's included on there is there's different research papers on consumption of fruits and vegetables, credible information about the science behind this area. And it was, again, developed by experts in nutrition, in toxicology, and risk assessment in farming. So this is what's really key here. It's not just nutrition. It's people that are actually experts in risk assessment and toxicology of these different chemicals. So being able to not only look at the amounts, but then looking at the metabolism of them and understanding the response, the dosage of somebody being exposed to it, depending on how much one might be eating of a given type of produce. There's pesticide residue calculators. You could go to there, and there's one on there depending on your age, depending on gender. That'll go through, we don't have time to do it now, but I went through it, and it'll do these calculations of what if somebody had, 3 pounds of strawberries a day, what would they be in terms of relative to what the EPA, the Environmental Protection Agency, makes as their standards for pesticide exposure. It's a very good resource to go to. There's blogs, there's scientific reports, and of course, for all our websites, we have to have Facebook, Twitter, and YouTube. So the concern with the scientific basis for this dirty dozen is it's not that it doesn't take into account the fact that risk is both exposure and toxicity. And there's very complex formulas for actually calculating that even the working group that put this list together says that on their website that this is not built on a complex assessment of pesticide risk. And that's what's critical to have to understand the health significance of consuming organic versus conventional foods. There are no reliable, well-established or accepted methods for assessing the risk of small doses of chemicals. A lot of research needs to be done on this. But this website will go into all the different research so far that discusses the amounts that are present. Most recently, with their Scared Fat program, again, concern that people are avoiding produce because of this fear. There's an expert panel that reviewed a nationwide study of 800 adults. And the survey examined the potential impact of this negative messaging on how consumers are responding. And they considered the impact of this messaging on consumer attitudes on buying fruits and vegetables. And what resulted from that is that they felt that the survey suggested an emerging public health threat where this negative messaging has an impact on food safety, or this negative messaging on food safety is reducing the consumption or purchasing of fruits and vegetables. We have an obesity epidemic. We all know that. It's all we all talk about in nutrition. And really, people might be having these increased fears about fruits and vegetables that's preventing them from purchasing them. It's also inaccurate to suggest that organic produce is the only safe produce, and that some consumers feel like they're making inferior choices when they buy conventionally grown produce. And really the key health message, as boring as it is about eating fruits and vegetables. And again, when we're trying to work with different populations that range with all sorts of incomes, to say that organic, when it's not true, to say that organic has been shown to be nutritionally beneficial or more beneficial than conventional is just not fair, because it costs more and we don't have any evidence to say nutritionally there are any differences. Okay? And in addition to that, the information that we have on pesticide residues also does not point to a difference. I'm going to show you some of the findings from the study that was just published last week relating to that, and you can make some of your own decisions on that. Okay, so is there scientific consensus that small amounts of pesticide residues reported to occur on some food sources are harmful? I'll talk about that in a minute. But we know about the evidence and of the benefits of eating fruits and vegetables and how they outweigh the potential risks associated with the small amounts of pesticides. And I'll talk about that too. Again, this paper was just published in a very established journal. But before that, realize that whether they're organic or conventional produce, that plant foods contain higher fiber or a good amount of fiber, several vitamins, minerals, and phytochemicals. And I forget now, Francine, you spoke about phytochemicals yesterday. So you already know how important phytochemicals are, and that we haven't even recognized and characterized so many of these phytochemicals found in produce. Now, organic plant foods may have advantage over conventionally grown foods, in some cases having higher amounts of vitamin C, in some cases having higher amounts of carotenoids, different forms of vitamin A, or that can be converted to vitamin A, and also carotenoids that have other beneficial effects on health that aren't related to vitamin A, and also polyphenol compounds. And these compounds are part of the phytochemicals that Dr. Steinberg spoke about yesterday, but what happens in plants, if they're grown organically, they might be exposed to more stress than those that are grown with pesticides, for example. And so they would be increasing some concentration of these compounds sort of to protect themselves. And so they may have, in some cases, higher concentrations of these different types of polyphenols. Okay, so those have been seen in different, for example, tomatoes and different types of onions. Okay, but in terms of pesticides, there's no convincing evidence that the pesticide residues right now that have been monitored pose a risk to health, in contrast to the data that you keep hearing about, we talk about on fruit and vegetable consumption. And you've heard about the possible reductions in risk provided by diets that are high in fruits and vegetables, with dealing with high blood pressure, with stroke, with heart disease, with some types of cancers, and digestive problems. The precise mechanisms that underlie these positive effects are poorly understood. They were mentioned probably a bit yesterday. But again, limiting one's diets to just certain fruits and vegetables and then omitting others because of concern about pesticide risk, and long as you wash everything thoroughly, can result in individuals making questionable decisions about what they're purchasing. And plus, if they're not able to afford organics, feel like what they're getting is inferior. So these are some studies, just a list so you have as your references of some analysis that address this issue. There's reviews, but the most recently one that just hit the press, the media, newspaper headlines, was a review from the Annals of Internal Medicine that talked about really very little nutritional differences and the low level of pesticide residues that are present. There are some differences that are expected between conventionally and organically grown foods. Conventionally grown crops have more nitrogen available, so they might lead to more growth. Organic crops, like I said, are often under more stress, and they then produce an increased amount of some of these phytochemicals. So you might see an increased certain types of phytochemicals. What that means in terms of human health right now is unclear, and that's what I mean by the nutritional value of that is poorly understood. But any type of important nutritional differences between these were not identified really in any of the above studies. I want to make that general statement, but give you a couple of the exceptions so I know you're getting it all. So in this most recent study that was published, there were no differences in vitamin or mineral content between conventionally and organically grown, with the exception of phosphorus, but in terms of nutritionally, we don't really see what that might have in terms of an impact on human health. No differences in protein or fat content in milk from conventionally or organically raised animals. However, there was some limited evidence for higher omega-3 fatty acids in the organically raised animals, so I think that's something that requires more attention. Omega-3 fatty acids are coming up as a key nutrient in terms of relationship between blood pressure and a whole variety of different types of inflammatory related conditions. But the pesticide levels of organic and conventional foods fell within allowable safety limits. That is, there are limits that are set what's allowed. So certainly with the conventional produce, they did have higher levels of pesticides. So it's not as if they were not there in the unwashed produce, okay? But they were all substantially below any type of limits that have been said or have been set. The lower levels of pesticide residues in urine of children consuming organic diets, that was observed too. Okay, so again, that might be expected. They're consuming organic produce. But still, the levels in the urine and other measures in the children having conventional were still below any type of limits that have been set. So I don't want to come across as closed-minded and just pushing conventional as the exact same. Okay, I think more work needs to be done on it, but in terms of the research that I've looked at and the most research that's been published, you have to consider both the dose and the exposure and the care of the produce, again, in terms of washing it, and understanding the science behind any of the claims that are made. And so I encourage you to take a look at that website. It's a very non-biased website. It's not a food advocacy group or industry advocate group. It is a group that is combining the interests of both conventional and organic. And it really does provide a lot of information. Okay, I want to go to the next big one, which is getting a lot of attention, is high fructose corn syrup. The most recent study that came out with high fructose corn syrup is no worse than real sugar. I mean, last year everybody was so worried about high fructose corn syrup that some of the companies were advertising that their beverage contains pure sugar, so it's much healthier. So first of all, we're all on the same page. Understand that the term added sugar is a definition that came from the USDA. It's added sugars are sugars and syrups prepared or added to foods in processing and preparation. It's a sugar that's not already present in foods. So you have intrinsic sugar, for example, in milk, which is lactose. And you have sugar that might be added to cookies. That's just a simple example. But here's a list of different added sugars versus naturally occurring sugars, with the one that causes me to get a lot of phone calls, are the high fructose corn syrup. Another emotional issue among parents, for example, but another very high interest issue in this country. So just to clarify what it is, make your own decisions. High fructose corn syrup is not pure fructose. Okay, there's two main types of high fructose corn syrups that are used in foods. There's a 55-45, so almost an equal split, just like one sees in regular table sugar or beet sugar. Okay, it's mostly used in sugary drinks like soda, as well as in ice cream and frozen desserts. There's another one, the 42-58 split, 42% fructose, 58% glucose, and that's mostly used in baked goods like cookies and crackers and so forth. Understand that the sugar, that the beet sugar, cane sugar that we see as well is also pretty much split, like I said, closer to this mixture here. So when you're seeing high fructose corn syrup, it should have never really been given that name. But you're seeing sugar. Not to say that sugar is a great thing. Okay, sugar intake is a concern in terms of consumption and its relationship to obesity. But high fructose corn syrup is not the cause of all of our problems in this country. And it has received a lot of attention about it. So, for example, when I'm out giving lectures to health professionals, and I'll be talking about fiber, for example, and the consumption of fiber, and I'll mention some of the fiber bars. I'll have people very adamant about, I'll never eat this. Look, it's got high fructose corn syrup. I'm going to eat this one that has sugar. And it's the same thing. Okay, and so what's happening is the high fructose corn syrup has been related back to studies that are looking at high fructose feeding studies in animals as well as humans. So basically the credible experts and different types of societies have not, from reviewing the literature, there's not a metabolic difference between the types of high fructose corn syrup I showed you on that last slide, especially the ones that are mixed equally of fructose and glucose, and regular sugar. It's more of a concern that we have an increased caloric intake and not a single sweetener that causes obesity. Now, what you hear a lot about is this term called sugar-sweetened beverages, or sodas, which of course is a concern, and we brought them out of K through 6, a lot of the public schools. And what is often pointed to is it's the high fructose corn syrup in there. The thing is, high fructose corn syrup is cheaper than adding sugar, and so these beverages are filled with that, and that's where that sugar content is coming from high fructose corn syrup. So it is a concern. These beverages are a concern. They're high sugar. It happens that they're being added. What's being added is this high fructose corn syrup. They'd be that same concern if they were added with high sugar coming from cane or beet sugar as well. So to discern for you of whether a new scientific study is actually pertinent to the realistic concerns about high fructose corn syrup, it's important to see whether there's actually controlled studies. So there's control and experimental group. And the subjects that are tested are, you look at humans after experimental animal studies are being used. And that one compares in these study groups or in these experiments, one's comparing high fructose corn syrup to actual sugar, beet or cane, for example. And the really, really critical thing is to look at the levels that are tested. The range of fructose in the diet is somewhere between 5 to 17% of total calories. Be wary of the studies are using very high fructose, 25 to 50% of the calories in humans, sometimes up above 50 to even 70. So really high amounts of fructose are seeing, what the results are showing are very different metabolic effects, but you're looking at almost pure fructose, not what we're seeing in some of our food products. And then in animals. And so we had recent studies, for example, at the UC Med Center that are looking at some of the higher doses, higher amounts of fructose in their feeding studies. And they're very careful in saying we're looking at some metabolic effects. This can't be translated to what the consumers are seeing right now with high fructose corn syrup. And I don't mean to say that we shouldn't try to be removing it or lessening it in our food supply, because we don't need all of the calories that we're getting from sugar. But it's not the high fructose corn syrup necessarily that's the villain. Understand it's very similar to sugar, if not the same. And understand, as you're going through your studies, how to look at that research and understand that one really needs to look at the levels that are being tested. Okay, there's recommendations, again, that are evidence-based recommendations. American Heart Associations have specific recommendations for sugar in general, and the dietary guidelines make their recommendations based on total amount of calories that are coming from solid fats and sugars. Those sugars can be from cane sugar, beet sugar, high fructose corn syrup. Okay. The other one, the next one and last one that I'll talk about is a very popular. How many have heard about gluten and all the signs about gluten? Just a few. Raise your hands more. Let me see. Yeah, more of you heard about gluten than anything. Okay, so first of all, gluten is sort of a group of proteins that are found in wheat, rye, barley, and oats. It provides bread with an elasticity and chewiness. And earlier, before it's received so much attention, some of it very valid, by the way, the main concern was in those with celiac disease. And celiac disease is an autoimmune disorder where actual exposure to gluten will result in damage to the intestinal lining. It's a very severe critical condition, and that damage to the lining of the intestine can reduce the ability to digest and absorb all sorts of nutrients, as well as lead to other types of pathologies. Treatment consists of completely eliminating gluten from the diet. Okay, so that's with those people with this autoimmune disorder, celiac disease. Okay, but that's not all that exists. So there's celiac disease, there's actual wheat allergies, and so there'll be individuals that are allergic to all wheat products, in part due to the gluten, but those individuals have to avoid they don't have to avoid like rye and barley and oats, but they have to avoid wheat. Then there's a more, I hate to say more popular, but more the condition or disorder that has now been grouped into this general term called gluten sensitivity. It's not diagnosed as an allergic or as an autoimmune type of mechanism, or through that type of mechanism. Does not mean it doesn't exist, but it has not been diagnosed through these methodologies. It is controversial and subject to risk of placebo, where any people that might have fatigue, joint pain, headaches, say, oh, I'm sensitive to gluten, I'm going to stop having all gluten products now, and oh, I feel better. So that's where they're subject to this risk of placebo effect. So with gluten-free diets, they are critical for individuals with celiac disease. It is the newest health fad with claims of more energy and weight loss, and there's very little research to support or disprove the claims. However, I do feel now that there is more research going into it, and there's now several different research laboratories taking a look at individuals with actual gluten sensitivities. So it's not to rule it out at all. And there may indeed be groups of people that are claiming they're gluten sensitive that actually are, while others might be just trying it because they heard that their friend feels better, so now I'm going to avoid all foods containing gluten. And sure enough, when they're avoiding those foods, they know they want to feel better, and they do. And what's happened with this is that there's a whole, you can see aisles and aisles in the grocery store of gluten-free products. They can be twice as expensive as gluten-containing products, and they may be low in certain types of nutrients, and the real thing is they may actually be higher in calories. So this was my favorite thing we put together recently, is have your gluten-free candy, Halloween, and eat it too. So it's actually marketing it like, now this is healthy, because you can get it, it's gluten-free. And so what studies have been looked at now, there's limited numbers of them, but saying that people that are, and I'm saying really limited studies, looked at those that are following gluten-free diets and those that aren't, and they're gaining weight on that because they'll see a sign that says gluten-free, it must be healthier. Oh, if it's healthier, it's lower in calories. Okay, oops. So that was just a touch on some of the issues. And they have my contact through this program that people can email me with questions. But there's also some really good websites about food and nutrition misinformation. So like I said at the beginning of this talk, it's exciting that nutrition right now, people are interested in it. But it's not a cure-all, but it is something that can be used to improve our quality of our life. But because consumers are increasingly taking charge of their life in this way, it can be a concern in that it makes people very vulnerable to misinformation. And then what happens is that consumers will lose faith in those of us in the nutrition as a science and stop believing anything that we say. And it has to be stated, and you as students and going on in this profession, to understand that it's a result, to make a really strong recommendation, we need scientific agreement, okay, that has gone through peer review, and the studies must be replicated. Big concerns are statements like that, like this at the bottom. Just eat whatever the heck you want. One day something's bad for you, one day it's good for you. Maybe I'll get lucky and smoking will be good for me too. That's what people start thinking when we as nutritionists keep so-called changing our mind as opposed to evaluating the literature that's out there. These are just for your resources. I won't go through and read them, but I'd like to just bring your attention. This is a great website for nutrition information, especially different types of health information. They'll talk on there, there's listed sites that you can trust. And this should be in your PowerPoint that all of you have. I see you writing it all down, but this is a really, really good source for you to go back to. And there's different nutrition and health search engines you can go to as well. Also websites with reliable information. Again, that's on your PowerPoint. And all of you did get the PowerPoint ahead of time. You have it, right, access to, because I hate running through the slides. It's what?
It's on titanium for them.
Okay. Okay. And so you don't have to write everything down now, but these are, again, very trusted websites to go to for nutrition information. These are very good on terms of the key things like I've talked about now that come up on key issues in nutrition. And of course, our website in the Department of Nutrition. This is the Center for Health and Nutrition Research, and then our general nutrition department website where we provide nutrition updates, nutrition fact sheets, and nutrition newsletters that are posted there as well. With that, thank you. And it's lunch, but we could, if there's any questions. I'm amazed you guys can sit through like this and you still have more to go. Any questions? Yes? Well, when that there'll be a whole range of different types of symptoms, but they'll be more diverse than just the gastrointestinal ones. So in some cases, people get rashes, joint pain, extreme fatigue. Just that some of those are so general, they're hard to diagnose. And so the way people will sometimes do it will pull out anything containing gluten and see if they go away. And if they feel better, then that's what they should do. But they need to be aware, and I would suggest that they go to a registered dietitian to make sure, to make sure that the diet is sufficient in all the nutrients they need if they're starting to omit things from the diet. That's my biggest concern. Question?
Really quick, so if there's only animal testing done and no human test after for high fructose corn syrup, you can't really
You can. It's the beginning. That's the best way to put it. You can't make any general recommendations from the animal studies. The general recommendations for the public will rely upon the animal studies that can look at more mechanisms, and then the human studies to see if those mechanisms actually can be translated and the findings can be translated into humans, so you know actual amounts.
So the first thing, you can't really trust the claims just from animals.
Not just from animals. Still useful though. Still useful because you can't get at specific mechanisms quite often without doing very controlled things in animal studies. You can control things in animal studies that we can't even begin to do in human studies. Yeah?
You had mentioned kind of the main point of it. Organic foods are basically just a lot of hype. In your experience in dealing with people, how have you kind of debugged a really strong additive?
It's always a challenge, and so I'm very careful when I'm dealing with the public not students, but dealing with the public, that I won't say it's just a bunch of hype. I'll say it in here. And I don't know if it really is a bunch of hype, to be honest. I mean, I think that in some cases there might be some nutritional differences, and we might find things in the future. So I'm very open-minded on that. But with the public, I'll talk about how nutritionally there's been very little differences ever seen, and that you need, for any types of fruits and vegetables, no matter how they're grown, they need to be washed very carefully, and that the residues are below what any type of safety thresholds have ever been set. So that's where I go with that. Very carefully, though. Yeah.
I know it might sound a little harsh, but I think it's like chemicals versus non-chemicals on your food. You know, I mean, it's kind of common sense.
Well, nutrients are chemicals. And so when I'm talking to consumers, it's making that actual point very clear, that the nutrients that we're talking about, these vitamins, the minerals, the phytochemicals, those are chemicals. And so we have chemicals that the foods are exposed to all the time, and even if they're organic, those chemicals are present in those foods.
Fertilizers.
Right. Bird droppings, animal droppings, human exposure, things like that. So it's a matter of how much one's exposed to and how much is present on the produce. So that's what I try to do. But I've learned through the years to be very careful in how I address the questions with the public, and very different than I might have, let's say, 15 years ago. Any other question? Yeah.
Is it still the reprints that they use for like the plant chemicals they use for like, is that organic farming and the normal typical farming?
I didn't hear the first part.
The reprints?
Yeah.
Is that still the typical, like, is that for?
There's a bunch of different types of classes, and that's actually not, I don't know the different classes that well. I know that certain ones have been pulled out due to toxicities and what also gets into our water supply and into the soil. But there's others that are still use the phosphorus-containing types of chemicals and pesticides.
Washed off.
A lot of them will be washed off, but there's environmental concerns that I think needs to be looked at. So I think those do exist. So I just know nutritionally and health-wise what I can say about what's left on pesticide residues. Yeah.
What about like organic meats? Like, would you say maybe that would be better because they're not treated necessarily with like hormones, or?
The questions about organic meats and with the hormones, the levels that are found in the conventionally raised ones are still below any types of levels that have been shown to be of concern. So again, for example, to be anecdotal with it, when I'm shopping, I'm not looking for organic beefs or organic milks or organic produce. I'm very careful in what I choose to, be with just talk about the washing of the vegetables and so forth. But with organic meats, I haven't seen anything that have shown that the hormone levels are so high are high enough to be of concern in the conventionally raised animals. I think it was interesting what I showed you. What their most recent finding was the omega-3s in the organically raised animals in the milk. So that definitely deserves further attention. Yeah.
Apply the same concept of products being natural and more processed to artificial sweeteners, like the difference between equal and stevia?
I think that the amounts that are used, they provide enough sweetness in very small amounts, and so those have not been through studies, been shown to be detrimental to health as of now. And aspartame has been tested to death without finding much, except for a subgroup of people with migraine headaches. With stevia is relatively new. It was a natural product people used, and now it's approved. And I haven't seen any kind of negative aspects of that either. I think it's really beneficial because of the calorie concerns. So, for example, I was just at a nutrition conference. I was at a general nutrition conference where they served sodas and diet sodas and regular sodas, and one of the people that was putting it together was like amazed all the diet sodas were gone, and she came and she goes, "I thought you people don't drink this junk." And I said, "No, a lot of us actually, the diet sodas aren't providing any calories, and so it's not as though all of us are saying don't ever drink that." So I think those sweeteners are beneficial. If people can have water, I still think it's beneficial. I mean, and I'm not going to go without my coffee. You'd have to kill me. But but water is still going to be healthier. But those, to get at your question specifically, those two are pretty similar in terms of what's been shown on reports. Okay. Yeah.
First, the omega 3 real quickly. Do you think that, is there, like with the hormones and the milk, is that something that's actually added to like the livestock animal, or is that just something that just happens to be because they're like living healthier?
No, they're actually added in some cases in terms of to increase growth and production.
Okay, so it's a kind of you're kind of ingesting.
It's for the industry.
Okay, so you're kind of ingesting.
Mm-hmm. It's a matter of how much shows up and what you're actually consuming when you're eating that product.
Is that true with like eggs and stuff? Like finding DHA, omega 3?
Well, with DHA now, they're adding that to the chicken feed, and so then you're seeing that in the eggs. And so you're seeing higher long-chain fatty acids that can be very beneficial. Yeah, and those do show up. Okay.
Great, thank you.
Welcome.